Please welcome Alexander Seitel, German Cancer Research Center, Heidelberg. Echo Track, a navigation system for the ultrasound probe.
Hello, everybody. Imagine you're a medical doctor at the beginning of your career, and your task is to perform a needle biopsy on the thyroid. I mean, I would be quite scared to insert a needle into a neck of a patient. So then an experienced colleague of yours suggests, why don't you use ultrasound to guide you to the correct place in the target? As you might have seen ultrasound in your studies, it's pretty hard to interpret. And using ultrasound during the intervention, you have to coordinate both of your hands, the scanning hand and the inserting hand of the needle. So what if I tell you that each day in Germany around 6,000 biopsies are performed, obviously not only for thyroid, but for various other applications. 70% of them are performed without guidance or with those ultrasound-guided approaches, and even 30% with computed tomography guidance. As you can imagine, the challenging cases are associated with complications, but also long procedure times, multiple needle reinsertions, or even radiation exposure in case of CT. We know from other fields that there have been remarkable technological advances. So those little devices we all have in our pockets can guide us to every place in the world, basically. So can this actually not be transferred to medicine, that we provide some sort of guidance on the image, augmented onto the image? And yes, there are various approaches in research and also in industry already that deal with those problems. However, none of them have found widespread clinical adoptions. Being the key challenge is that the clinical workflow integration is still not perfect, that they are not all robust in all the clinical scenarios, and some of them lack the intuitivity of the usability. So we have developed a system we call Echo Track, where we actually place a very small sugar cube-sized tracking source onto an ultrasound probe. We can actually clip it on and clip it off a regular probe quite easily. We attach a sensor to our needle, in this case a biopsy gun, as you can see here, and then we are able to provide guidance, as you can see here, where we overlay the ultrasound image with navigation information to actually safely guide the clinician to the target. We are currently in ongoing preclinical and clinical investigations that are promising, and we can show already that we can facilitate biopsy for non-experienced clinicians, reduce the procedure time and the number of needle reinsertions, and enable free punctures, so-called out-of-plane punctures. We're also looking in the potential of commercialization of this project, and I'm happy to discuss further details in the speaker's corner with you.